It is the most common form of cancer impacting men behind skin cancer. We're talking about prostate cancer. And we now know that President Biden has an aggressive form of prostate cancer. It has spread to his bones. So that's what we're unpacking today on The Healthy Dude. I'm Kurt Williams. I'm a recent prostate cancer survivor myself, so this hits close to home. And we're joined by Betsy Carroll. She's a cancer community educator with Sentara Health. Betsy, thanks for joining us today on the Healthy Dude. So I would imagine when people started to hear this, they're wondering what does this mean? What does it mean for me? I mean, if anyone gets awesome health care, it's the President of the United States. And so to hear that it is metastatic prostate cancer. All right, for the non-medical people, what does that mean?
Well, first of all, thank you for having me. So glad to be here today. I was also surprised at that diagnosis as well for the same reasons that you were talking about. But what is prostate cancer? Or
Well,
what is metastatic?
Metastatic.
Okay. So metastatic just means that cancer, wherever it is in your body, has, if there's a tumor or a spot that it started with, it has gone outside of that organ area, that soft tissue area, wherever it started, and gone to other systems of the body.
And that's bad.
That is bad.
I know with my diagnosis, I wasn't that shocked that I had prostate cancer because my father was successfully treated for prostate cancer.
Yes.
But so once I learned the news, then I'm moving on to the next thing. All right, well, let's look at all my treatment options. And so after you have the biopsy that confirms you have prostate cancer,
right?
Then the next thing my doctor said, okay, now we're going to do like a full body scan to make sure that it hasn't spread outside of your prostate.
Which I'm sure made you a little nervous.
Oh, I tell you, that was probably when I talk to people about my journey. I wasn't so much like terrified when they said, yes, you have cancer. But when they said, all right, the next thing is we got to schedule a scan to find out to make sure. And so I'm thinking, all right, how long has this cancer been in my body?
Right.
Because I know that once it leaves the prostate, then your treatment options change and are limited.
That's true.
So when we hear that it has spread to his bones, what does, and I know you're not the president's doctor, but
right.
But what does that tell us that it's spread to his bones?
Spreading, when a cancer has spread to the bones that didn't start within the bones, that is usually a dire type situation, just because it means it's probably in the blood system, it's maybe in the lymph system, it maybe has gone to other systems first.
When I was reading some stats about this, I think it was like, I guess early stage prostate cancer, if you catch it and it's not metastatic.
Right.
The 5-year survival rate is like 97%.
Exactly. Super high.
And then metastatic, it drops down to about 37%.
Exactly. Yes. And that is just because you're dealing with other systems. When you just have cancer in the prostate, you can have it surgically removed to start with, if it's a tumor size thing that needs to be surgically removed. You can have radiation, chemo, all types of other, treatments, immunotherapy, those type of things. And because they, know, they do the biopsy, they know maybe what type of prostate cancer, because it may depend on if it's something that grows on certain types of hormones or not, different types of things. So they see what it is, they're targeted in that area. When it starts metastasizing to other systems, those treatments change. So for instance, if it was just his bones that we were talking about, then you'd have to think, okay, well, what types of chemo, radiation, and all that would we need for that type of cancer? Now, those may overlap, but they may be different, and they may not actually work well together. It may cause more devastation on the body, maybe longer times between treatments. It's just, it varies.
So the treatment path is more complicated.
Exactly. Yes.
When his office says that he was experiencing increasing urinary symptoms, I know with me, I had no symptoms. I had zero.
That is the most common symptom.
It was just like a regular checkup.
Yep.
I do know that, and I've shared this, that my PSA, it was around, which is, I guess, one of the screening tools for prostate cancer.
Yes. Yes.
It had maybe bumped up to like a 3.1 or 3.2, but on my most recent visit, it dropped down to 2.9. And I was like,
Great.
yeah, heading in the right direction. And then my doctor, who knows my family history, and knows that African American men have just an incredibly high rate of prostate cancer.
Very much so.
He said, we got to do the finger check.
Yes. Got to do that exam, the physical exam.
And that's when he said he felt something. He felt a nodule. And that's what tipped him off,
Right.
that, okay, the next step is we need to have
Right.
a biopsy.
Because just having one test sometimes isn't the end-all be-all. So that whole spectrum of looking at family history, any kind of genetic component that might be there, which kind of hooks in with family history, but symptoms, age, all these other risk factors that, race, as far for African American, Black men, higher risk factor. So there's looking at the whole picture is the best way to go at any type of cancer prevention, but especially prostate.
What does it say that he was having urinary symptoms?
Usually when people start to have symptoms, they're in a later stage. Usually, not always, but that is what historically happens. When you get those, some urinary symptoms can happen early. I'm not sure what type of urinary symptoms he had, but if it was something like blood in the urine, things like that, then the cancer itself might be worse.
One thing I learned during my journey was educating myself on the Gleason score.
Yes.
Because it really wasn't, while I was waiting for my doctor to get back with me on the biopsy results, I got a notification in my chart. So even before
Yes.
before he could call me, I'm going, well, let's see what's popping
Right.
up in my chart. So I go in there and look at my little patient portal, and it was all this medical speak, and it was positive, negative, and then it was talking about a score, and I'm like, all right, I'm going to have to Google this, which is probably the worst thing to do, but I did.
Well, sometimes you can find some good stuff on
And
Google.
so I found that like one of my Gleason scores, which I guess it goes, from 6 to 10?
Yes.
And on the lower end is better, on the higher end not so good.
Right.
And so I started adding up my Gleason score, and one of them was an 8. And
So you're like, uh-oh.
so when I Googled, all right, what's it, 8, is that? And they were like, that's not really good.
Right, right.
And so when I talked with I called my doctor and said, hey, I'm Googling some stuff. This is not good. What does this mean? Do I have aggressive cancer? And
Right.
so he said, yeah, he said, you got the information before I had a chance to call you. And I said, it's fine, because I didn't want to, just sit around and wait on your phone call.
Yes,
And
yes.
but he said because you do have an 8, he said this isn't something, watchful waiting, which is a phrase that you might hear if it's maybe like on the low end on the scale. Well, let's just kind of watch and monitor, because in most cases, prostate cancer is slow growing.
Very slow growing. In fact, most men that have prostate cancer die with it, but not of it.
Yeah.
So they die with it because it just is so slow growing that they will not treat it. Not a big deal.
But when
just monitor.
Yeah, but he said, in my case, he said we cannot do watchful waiting. He said because that 8 is not good. That's a bad actor, I think he said.
Right.
He said so we've got to start talking about your treatment options. From what I'm reading, President Biden's was a 9.
Right.
I'm imagining people are wondering,
Right.
how is it that the former president didn't know sooner, and not
Right.
and we're not in any way trying to judge or second guess, but
Right.
there's been some talk that maybe because he was up in age, maybe he was no longer getting screened.
Right. So
Is that common?
that can be common. Yes. So especially in prostate cancer screening, we do a big shared decision-making conversation. I do this in the community setting. Providers do it probably in even more extensive one if they see the person year after year. It's like, okay, well, this is your set of risk factors, which there's some that you can't change, like age.
Or your race.
Race, or that you're a man,
Yeah.
right? Some of them you can, like obesity, diabetes, alcohol, tobacco smoking, all those kind of things, right? So some of those you can. So what are your risk factors? What is your age? If you've had tests before and they were normal, then, maybe we don't need to test after a certain age. Maybe it's, 75, 80, somewhere in there. They may have decided that.
Because we know, or at least, we hear. I know that just in doing stories on this and sharing my journey, if you have a family history or you're an African American male, you're encouraged to maybe start at 45.
40 now. 40.
It's 40 now.
Yes, sir. Yes. Some of the new research that came out a couple years ago.
Do you know why it was bumped up to 40?
Because African American men get cancer younger and more aggressive cancers, so they wanted to bump that down. So it wasn't, usually prostate cancer, slow growing, right? So you could wait. You could wait till that 40, that 45. Or 50 even for average risk.
I know there's if you don't have any family history and if
Right.
you're not an African American male, you can wait until you're
Right.
50. But you're
So-
saying for family history or African American male, now start at age
Yes.
40.
So if increased risk. So if you know there's a genetic component in your family, like you've had immediate family members with prostate cancer, if you are African American male, any of those kind of things, between 40 and 45 is when you need to get that baseline, because getting that baseline is super important so you can have those comparisons as you go forward.
When you say baseline, what? Just
First
know right out
one,
the gate
first
what your
screening. Yes, first screening. And that first screening usually is the PSA. So that's a blood test, guys. All right, so just so you know, that's the blood test.
You
It's
don't
easy.
necessarily have to have the visit from what I like to call Dr. Jellyfinger.
That's
okay?
right. That's
All
right.
Okay.
That's right. Now, and that you might need that in your case, that they're like, okay, these are risk factors. You've got this PSA, but we want to check and make sure with that physical exam.
Yeah.
So, but that is the first line of defense right now, because the PSA has been shown to catch like 99% of the cancers and at early stages.
So we're pretty clear on when we should start the screening.
Right.
Doesn't sound like there are any set rules on when you should stop the screening.
Not exactly. That definitely depends on the person. So it depends on your health. Are you someone who at 75 has multiple conditions going on that maybe, even if you found a cancer, you wouldn't treat it? Is it something that you've had normal exams and maybe at a certain point your doctor and you decide, no, we don't want to screen any longer because even if we found something, we wouldn't treat it? Or is it that, yes, you're somebody getting out there. My grandma, who's 99, she was mowing yards last year still. Yeah. Are you somebody who's going to have that longevity, and if you found something you would treat it, then maybe you would. But that whole conversation must be between you and your doctor, because it's really individual. And one of those reasons is because if you did find a cancer and you decided to treat it, then there are complications that can happen from that. And not that the doctors can't help with those, but it is something to think about when you do have the screening and decide if you're going to treat or not.
Because sometimes, because it is a slow-growing
Yes.
cancer,
Right.
you might not want to say, all right, we got to do all of this kind of treatment when you're at a certain age where maybe the treatment might cause more harm.
Exactly. So, first do no harm. That's what the doctor's Hippocratic oath is. And so we try to have those conversations so that, we let the patient choose what they would like to do and let them know all of the consequences, pro and con for those decisions.
So back to the PSA.
Yes.
And I've just heard it so many times that I kind of know when it's considered to be in the maybe not so great range. But what is considered, we don't have to sound the alarms kind of range?
Okay, so that actually depends a little bit too. So this makes it a little more complicated. So if you start on the younger side, like that 40 to 50, that is a certain range. If you are older than that, then you go up a little, because the prostate, as you get older, acts differently. The hormones change and stuff like that, so you're going to have a little bit of enlargement as you get older, just because, sorry guys, just happens as you get older. But So we have different ranges for different ages. So, but normally if you get around that 3 or higher, then that's a like ding ding on your provider, like, okay, well, let's check it out, see if there's anything that other risk factors, things like that. Getting close to that 4 or higher is when we definitely want to talk to your provider and get possibly follow-up testing. And I will say also, a PSA, let's say that I'm out in the community and we do PSA screenings, which we have several events coming up this year, so check it out if you are interested. But there are things that if you've had certain types of activities, if you're an athlete, if you're, certain types of things that can increase your PSA abnormally. I know.
I like how, what's awesome is how Betsy has covered other activities. Because one of them is like if you've had sex.
This is true.
Or I guess.
Yes.
Or,
well, because the prostate is a reproductive organ of the body. Yeah.
And so anytime you ejaculate,
yes,
it can throw off your PSA.
It can. It can abnormally increase it temporarily. So if you know that you're getting a PSA, you would want to abstain for a few days before.
See, the men don't want to hear that. Wait a minute now.
Sorry.
Wait, what now? But
just a couple of days.
But so that you can get an accurate reading.
This is, yes.
Now, I'm trying to remember if this was something I heard just in chat or if this was one of my doctor's visits that said, bike riding? Can that?
So anything that is going to put heat, pressure, just increased activity to that area that's not like your normal day-to-day would be something that might increase it. So
like horseback riding
possibly.
Or bike riding, that could?
Yeah. So just things to think about if you're going to get the test. But if, let's just say you got the test, you didn't know about that, it was abnormally high, no worries, because the first thing your provider is going to do when you go see your doctor is do that test again. So just because you got one high PSA doesn't mean that that's your number forever. So they're going to retest you. They're going to look at everything else. So yeah.
And so you mentioned that, and I guess this is part of being a cancer community educator.
Yes.
Is if they won't come to the doctor to get the PSA,
That's
you
right.
will go to them.
That is correct. So we partner with churches, organizations, other events that are going on like health fairs, races, anything that's going on. And if they want us to bring that prostate cancer screening, then we do. So we bring the phlebotomist to take the blood test. We have a nurse there, maybe me, maybe someone else, talking about that shared decision-making part. We might even have a whole educational presentation with it, depending, sometimes survivor speakers. And then they can just get their blood test. And then I follow up. There's 4 of us in all of Hampton Roads, so we follow up with all the screenings, let them know if it's abnormal, normal, and then next steps.
Do you try to go into communities that maybe don't maybe have the best access to good health care?
We look for places that are some healthcare deserts kind of areas, also just populations that either don't trust the healthcare system very much. We try to build that trust with these organizations, with these groups, and also those that maybe are uninsured, underinsured, just working people that feel like they don't have time to go into the doctor. So any of those populations.
Do you find men in particular, we're a little hard-headed when it comes to our
Sometimes.
health? And particularly in that region?
Yes. Oh, yeah. Well, actually, if you get a group together, like when we do our events and stuff, they motivate each other.
Okay.
It's really great to see. It's like guys sitting around having coffee or a beer or something. Like, hey, man, come on. You need to have that test. Let's do it. And it's just really great to see. They don't really want to talk about it too much, but, we cover what we need to cover. And it becomes easier for them as we kind of educate and just kind of chat a little bit and stuff like that. So,
back to the president, who is 82. We have no way of knowing at this point,
right,
what led up to this.
Correct.
But I'm wondering if you're like you're wondering, like, if your doctor is giving you the option saying, you know what, you've reached a point now where you don't need to have screening. I mean, what do you, so that we can be our best advocate.
Right.
You know, what are the takeaways if the President of the United States
Right.
has an aggressive form of prostate cancer, and there are screening methods to try to catch it before it gets to this point? What are
Right.
the takeaways? You know,
Well,
because you know you trust your medical
Yes.
professional, and if they're
Yes.
giving you the option of you no longer do this, you know, because if we catch something, you know, your body is not going
Right.
to. I mean, so what's the takeaway?
The takeaway is, for me and for what I'm going to talk with people is, you know, early detection is the best way to prevent having to treat cancer at a later stage. So that's what we always talk about. When you get to a certain age, there's that discussion. But, I mean, you know, I can't really say what their doctors did, but most of the time you have to be your own advocate, even when you're going to the same doctor all the time. If you feel like something in your body isn't exactly right, and you don't, maybe you can't put your finger on it, you know.
But in the case of prostate cancer, I mean, you don't
You
want to
might
get
not
it.
even,
You don't
no.
want it to get to the point where you're having some kind of
I know.
increasing urinary symptoms. I mean, you want. With
Yeah.
me, I was going to the gym. I was. I mean,
Exactly.
life was good, and so there wasn't anything that gave me
Yeah.
a heads up. And so
We
I'm
hate
just-
to tell people, like, always get it every time, even until you're 100, because that's not necessarily the case for everybody,
Yeah.
and they don't always all need it. So that's a really hard gray area.
Yeah.
I mean, I really think you have to just look at your wrist and all that. I mean, I would say President Biden wasn't obese. He probably didn't have, you know, many other things going on. Perhaps it was in his family that we don't know about.
Yeah.
Perhaps it was something like that. But he is, you know, later in age. So, you know, as you get older, the prostate as well gets older and has changes. So,
Because you know what? As far as about his being up in age, I mean,
Yes.
I have heard other medical professionals say that what you mentioned earlier, that a large percentage of men will die with prostate cancer.
but not of it.
Not of
Yes.
it.
Yes.
And so if you hear that, you may think, all right, maybe it's not that
Right.
big of a deal for me to continue
Right.
the screening.
I'm going to say with him, I really think this is a rare instance unless for some reason they just didn't test him for many
Yeah.
years. I mean, that could be possible. We just don't know what was going on. And if, you know, because usually these things take a while, even the more aggressive ones take a while. So I just think it might just be something that is rare for him, possibly. But that's it, with any cancer, really, they act in crazy ways sometimes, and we just don't have all the answers. That medicine is a science that keeps growing, and we find out things new every year, every month. So possibly we'll find something from this.
And you have transparent conversations with your medical provider. I
Yes.
mean, and
Yes.
and know your own family history.
Yes. And in community events, I actually give out family trees so that people can do their cancer and other health issue family tree. Like, know why Grandma Sally died when she was 40. Please ask before the people that do know are no longer with you.
Yeah.
So finding out that family tree, and maybe, you know, you're that older person in the family that can fill out that family tree for your younger folks. I think that's really important.
All right. Betsy, thank you
Yeah.
for joining today. I really appreciate this. Betsy Carroll, a cancer community educator with Sentara Health. And so for people who, I guess they can go to Sentara's website to find out where
Yes.
you might be going out into the community for some of
we
your...
actually have quite a few things coming up. The first one being on June 21st at New Zion Baptist Church in Williamsburg. So,
But what's the best, like in case someone stumbles across this later on after
Yes.
after that one, what's the best website to?
Sentara.com/events. Most of them will be on there. Some of them won't be on there quite yet because maybe they're in September,
Okay.
August, but keep checking that.
Betsy,
Yes.
thanks so much.
You're welcome.
And we thank you for joining The Healthy Dude.